not just survive during this pandemic. So today I just want to start with celebrating the wins. We had some wins since, we last got together. Miss Shirley had her 70th birthday party. And I know we looked through some of the pictures last time that we were here, but that we were together. But, we really need to wait until about 10 to 12 days after the event to really calculate what impact the biosafety protocols had. I just want to remind people that Miss Shirley had about 100 people at her party. They came from all over the United States, California. I think her nephew came in from Thailand, but then, made a stop in Texas and then came through Texas, the East Coast, California, from all over. And then, of course, a considerable amount of Chicago people were there. So as of this day, we know that there has been now. Oh, also want people to remember that not only did we have people that came from all over the United States to celebrate her birthday. Most of the people are what would be considered in the high risk age range. Mostly over 50. Considerable number of people over 60. Not only did we have a great time and we misbehaved and had fun and all of that. It was all of that. But, at the end of the day, because of the biosafety protocols that got put in place, there was no one that caught COVID. Absolutely no one. So, I'm just thankful that for Shirley's willingness to put together allow me to put together the protocols. I'm blessed and honored that she trusted me with this. And I'm just happy and thrilled that people of, our age and older could get together, have a lot of fun, and do so safely. And the reason why I want to celebrate this win and keep punctuating that is because I do know a lot of older people. When I say older, I mean 50 or older, some, 60s, 70s, who are talking about that they're not traveling like they used to, or they're not doing the things that they were accustomed to doing, and that they're not living robust lives. And I just think that with the products that we have now and what we know about how we can protect ourselves, there's no reason to not go forward and live robust, joyful lives. Especially if you are willing to follow the protocols. I mean, just follow the safety protocols. And they're really not that challenging. So there's that. Okay, so yay, Miss Shirley. Okay. Nobody got COVID. Nobody. And she had about 100 people. And she was real clear with me at the very beginning. She wanted to celebrate her birthday, but she did not want it to be a super spreader event. And it was not that at all. The only thing that was super spread it was joy and laughter and fun. And that's certainly what it is that we do want. The other win is I want to talk about my daughter, my goddaughter, Taya, who she came into Chicago for the National Organization of Minority Architects. And she was one of the programs. She helped organize and help do some of the programming for that event. And she was concerned about coming in because there's 45,000 people, and even though she talks to her colleagues about the biosafety protocols and the things that they could or should have in place. And they did do some things, like they had on-site testing, and they did follow some of it. But she talked about how, she wore her ionizer every day. She used her skin guard every day, okay, without fail. And she had a mask on, on her person. And she also has an air cave, although she didn't use it that much. But she did go out to dinner, and she did hang out with her friends at meal times, or her colleagues at meal times, always with her ionizer on. So as she returned home to Philadelphia, she started getting the reports back from various colleagues who were testing positive for COVID, and she was getting nervous. Like, okay, oh, I was at dinner with that person on Wednesday night, and now they're testing positive for COVID. And then there was, or I was with such and such person 3 days this week, for a couple of meals and a couple of conferences, and we were just sitting shoulder to shoulder, and they tested positive for COVID. And then the last night of the conference was not this past Saturday, but the Saturday before last. And she said she was at a dinner with about 10 other people, and about 7 of the 10 people all came out tested positive for COVID. And then that's when she got really nervous, because she was like, I was with this group. 7 out of the people tested positive for COVID. So when she got back to Philadelphia last Sunday, not this past Sunday, but the last Sunday in June, she'd been testing every day. So today, Friday, we started taking a look at Friday test, Saturday test, Sunday test, Monday test. She has been fine. She's fine. She never caught COVID. And so, and the reason why I wanted to talk about celebrating the win is because a lot of times we're wearing whatever we're using whatever we're using. And sometimes you don't really know that it's really effective and that it's really working until you are in a situation where everybody else got COVID and you didn't. So at the dinner where 7 out of 10 people got COVID, she was the only one with an ionizer on. And she said it was funny. All those people that asked me about what it was, once they got COVID, they started calling her to say they were getting ready to order one. Okay. Well, it's too late now. It's not going to keep you from getting COVID now, but it'll keep you from getting COVID again. But, so all I can say to everybody is celebrate the wins when you find them. When the people that you have talked to, when they come back to you and say, I was in such and such a situation, I was afraid I was going to get COVID, but because I did use my ionizer and use my skin guard together, I didn't get it. And I was in the midst of a situation where it was definitely spreading. So, so that's a win, and I'm thankful. It's my goddaughter. I love her dearly. So I don't want anything to happen to her. And I'm just glad that she, paid attention and, did what she needed to do and was strong and steadfast in doing it every day and making sure that she had her stuff with her and on her person. And, and at the same time, she was willing to, tell people, teach people, but, it's up to them to decide what they want to do or are they going to do. So on that note, I'm going to ask, are there any other wins that people experienced this week in terms of either they recognized that they were exposed but didn't get it because of the biosafety protocols that they use, or they talked to somebody who then, used it and used the biosafety protocols and they didn't get COVID and they now recognize that. So are there any other wins that we can celebrate? Uh-oh. I know I'm just throwing that out there. You have
well,
time to think.
Definitely not COVID related, but I consider it a win. I got promoted.
Oh.
Yes, I got a promotion.
Congratulations. That's awesome.
Thank you.
That is awesome.
Come July 18th, I will be a business analyst in the clinical quality program department under population health. Mm-hmm. So no longer a trainer in 2 weeks. I'm excited.
Okay. Well,
congratulations.
Thank you.
Yes, that is.
Thank you. I know I'm very excited about it. It's an advancement in my career.
Absolutely.
Yes.
Yep.
So,
And
but,
they made it worth your while, given all the bonus money you got for traveling, right?
oh my goodness. And I was able to tell them that in the interview, like, yeah, I'm leaving money on the table. So it needs to be made up in this role. So I'm waiting to see what the actual offer is going to be. And if
Okay.
it's not sweet, sweet, then I'll just take this and, use the experience and the time in and go work for NCQA.
Yeah, we don't take that and say, okay, well, we can go somewhere else with this title and this change, this position change, and set our sights somewhere else. But I'm
Yeah,
so
bigger fish.
uh,
Thank you.
absolutely, and that is a win too, because if I think about it, one of the things that made it possible for you to do the traveling is because you learned the biosafety protocols and was able to apply them, and you were one of the few people in that company.
Yes, who had everything.
Correct.
I was
Correct.
prepared in
Correct.
more ways than one. Doctor, in my interview part of my application submission, I was able to talk about our community that we host every Tuesday and
Mhm.
how we are engaged around this pandemic. And, we're meeting a need in education. And
Mm.
because we are meeting that need, we know that there has been, and it will, it's going to evolve into a quality program once there is enough data research on long haul COVID related illnesses. So that will eventually, I give it the next 2 to 3 years, it will definitely make its way to Medicare and private insurances because
Mhm.
people are suffering with multiple chronic diseases because of COVID, and they need to quantify how the care is given. And
Correct.
so, yeah, so that helped me having that knowledge and that
Mhm.
insight. So I want to thank you all for making it possible for me. It's just like you can see the linkage, right, that we have to each other when it's applied correctly. Like this happened because of you all. And I am just extremely, extremely grateful and thankful for our community. I will definitely, I don't know which direction Doctor and I will be going in with our community, but I will definitely keep you all posted in the future about quality measures, what's actually happening in that realm when you go to your doctor. But one thing I will say, and I'm gonna turn it back over to Doctor, is my vision in uh, conversation, my discourse around clinical quality programs inside of healthcare information technology is patient focused and patient centered. I'm not a nurse, I'm not a clinician. And so therefore, I don't use all the medical terminology, medicines I cannot pronounce, and all the specialties I don't know. But this is what I do know from traveling across our country. We suffer from 3 chronic diseases, and it doesn't necessarily matter what race or ethnicity you are. It's diabetes, high blood pressure, and high cholesterol. They call it the triple threat.
Mhm.
And so my vision for myself is to take these quality programs that are happening, regardless if you know or not, right? If you have high blood pressure, you go to your doctor and they're documenting your electronic medical record. You don't know that how your care is given. The doctors are being measured, especially if you have Medicare. It's highly regulated, and the doctors do get a percentage back based on how they're caring for you. But I want to take this knowledge to the people so that they can be engaged in their wellness and how they access their care, which at a layman's term, it could be mediocre. But when you have the right information and the right knowledge and the right understanding, you can take that mediocre care and turn it into quality care because your physicians and your care team, they know what you're talking about. And that's what's not available to us. One more thing, just like the information and the education to keep ourselves protected, understanding how this virus is transmitted, what forms, we know it's the 7 F's and an R, and we are not being educated on the personal protective equipment that can take care of us and protect us and our family. Dr. Blessing and I, we know that we are a small group, but we have a great mission. And so it's the education piece that's missing. And it's also the education piece that is missing in quality care programs when it is definitely patient-centered. So thank you, Dr. Blessing. Thank you, group. Thank you, team. Thank you, community. Thank you, family. Thank you, village. I appreciate you.
Absolutely. And Michelle, I think you're right. I think that I wholeheartedly agree that the education piece around how do people prevent catching COVID in the first place is going to become much more relevant than now starting to do research. And we'll get into a lot more detail about that at a later meeting when we talk about long haulers and reinfection and what happens. Ms. Walker Shirley sent me an article about the studies that they're doing now around people who are getting reinfected twice or 3 times after COVID, and the changes to their healthcare status as a result of those reinfections. So, so for those of us who are, I think, from the beginning, we've been on the right path, which was try to prevent getting COVID to begin with. Many of the folks here have either not had it or maybe only recently had it, like 2 years later. We've done, so I think that's a pretty good record to be able to say, okay, a lot of the people in this group have not really either not had it or maybe only had it once, and that was only 2 years, into this. So we are, again, on some level, we have to take care of ourselves, but I think that you are at the vanguard, the cutting edge in terms of this information and knowledge. Someone mentioned, I think it was Ms. Wright, mentioned that somebody that she knows is planning a wedding, and they're using the biosafety protocols. Miss Carol Blaylock Wright, who's planning a wedding. Yes. I have we've had Jennifer Jones from what's the name of her events? I can't remember the full name of her events company, but she does a lot of upscale weddings. And she's been one of the persons that I've worked closest with in terms of event planning around weddings, parties, just in terms of how to make those occasions not a super spreader, and then how to work with clients in terms of making sure that they feel confident and comfortable with sticking to the protocols and asking their guests to stick to the protocols, because you will get challenged. As Ms. Shirley can tell you, yes, there will be people in your group that will challenge you. But why we got to do this? Or did you really mean that? did you really mean that I needed to do that? Because they special, that rule was for everybody else, not for them. So you'll get all of that, Um, so yes. So, we are at the vanguard. And so, I know it may not feel like it because, as you know, so people have been calling y'all extra, calling me extra, what's she doing? Da, da, da. But what we're doing works. And people will get it. We are ahead of the curve. And that's really what it comes down to. We are ahead of the curve. So, let us get on to tonight's topic, which is caring for a loved one who has COVID. Now, when I chose this topic, I did not know that I was going to be speaking from personal experience,
Right.
because we had this topic in mind about a month ago. So tonight I'm going to tell you about two situations. We're going to go into the detail at the end, or more towards, or later on into the conversation. But yes, I'm going to be speaking from firsthand experience, and I want to share with you sort of the more personal details. One is the first person, or the first couple that I had where I dealt with COVID and helping them with, once they got diagnosed with COVID, was a friend of mine who lives in Honolulu. So that can be challenging to work with someone who is a couple that I'm very fond of. I just saw them in February when I was in Honolulu. The woman is in her late 70s. Her husband is in his early 80s. And but we were able to coordinate care from across the pond, so to speak, and make sure she had everything she needed for her and her husband. And it was like, okay, calling in the cavalry, calling up people and said, okay, we need this, and this for Sharon and Thurman, and then the other person that I had firsthand experience talking about taking care of a loved one with COVID was my son. Yes, my son got COVID. He's 14. Let me start off by saying that my son is a little bit of a contrarian. Not a little bit. He's a contrarian. If mama say the water, that liquid is wet, he's got to stick his toe in it to make sure that it is wet, because he won't take mama's word for it. Okay. He is he's a kind of kid who learns from experience best. He's not a kid who learns from you talking to him or from him reading a book. He actually has to work with, manipulate, and he learns from direct experience. So, I'm telling you, he's 14. So, I'm getting ready to have a hard time during his adolescence. Because, because kids who are experiential learners, they like to experiment. They have to touch everything. They have to experience, they have to live through some hard knocks before they get the message. And I just have to steel myself up as a parent, gird myself up, because that's the kid that God sent my way. Okay. He's gonna go through life experiencing some hard knocks before he learns, and that's who he is. Okay. So in his head, he was sitting here saying stuff. Oh, nobody's getting COVID in 2020 in 2022. And I had to pull down the stats and say, yeah, people are getting COVID. They're just not talking about it as much. And then he said, well, you got to be stupid to get COVID. So one of the things he had to do was write an essay about the fact that he said you had to be stupid to get COVID. And then he got COVID. So he needed to explain to mama in an essay how he got COVID. So I will tell you the full story about that as we go further into this. So let me just say, there were, we in our book, Navigating a New World, there is a chapter dedicated to taking care of, if somebody in your family gets COVID, what do you do? And there's some things that's in the book that did not change. Even as we look at 2022, the book was written in 20, I want to say, was it written 2021, I believe? No, 20, it might have been like the end of
2020.
Yes, 2020. So some things have changed because we now have, better treatments, and we have better equipment to protect ourselves. So some of those things have changed. But some of the basic stuff has not changed.
Right.
So one of the things we talked about in the book was, first of all, to have a plan. What would you do, to think it through, what you're going to do with just somebody in your family get COVID. So it was easy in the sense that, so we just started, and I wrote the plan out because I needed it for my husband in case I wasn't around, So we just went through the list of, this is what you do. Because he just sort of like freaked out, like, oh my God, my child, he started saying he had symptoms, and so what do we do? I said, well, first thing we do is contact his physician and let her know. My child does not have comorbidities, but I would suggest that anybody that gets COVID, first thing you want to do is contact your primary physician. And if they're still providing telehealth support for people who are newly diagnosed with COVID, when you don't have a primary physician, then you should use that service if you can. You want to make sure that they know what comorbidities you have and know your full health status, because that will determine whether you're going to get access to any early treatment possibilities. And the reason for that, and I'll give you just an example. When my friend in Honolulu was diagnosed with COVID, she was sent home. They told her this. They just sent her and her husband home. Well, he got remdesivir because he has diabetes and a heart problem. So they immediately put him on remdesivir. He was doing fine, but they sent her home without giving her anything. And I was like, I thought that was, and just they basically told her to go home and isolate. And I said, this is a couple that's in their late 70s, early 80s. You don't send them home and tell them to isolate. That's crazy. Okay. No, because COVID can, and then on top of that, she has asthma, and she has pretty serious case of asthma. So I don't know if she told them that she had asthma when she tested positive. But anyway, we do have friends, and I said, well, call Joanne, your Dr. friend Joanne, and ask her what else you might need, because I think you might need to get a emergency script for Paxlovid, because you have asthma and you should not be. We're not just gonna send you home, So and so that's what she did. But anyway, so contacting your primary physician or someone who knows your medical history background is very important, so that you can access whatever the early treatment options that are available for you. Not everybody's going to have early treatment options. My child is not, because he doesn't have any comorbidities. He's not going to have any early treatment options. And that's cool. That's fine. But that's why you want to, first thing, contact your primary care physician. Now, I know some of you that are on this call have also helped other people who got COVID, and cared for loved ones. I know. So chime in if you want to add something to it. And then, of course, I pulled out the pulse oximeter, and of course I had something to measure the temperature, not the kind that you put in your mouth, a thermometer that you put in your mouth, but the kind that you either aim at your forehead or a contactless thermometer. So the thing to remember about pulse oximeters is that I had it in my bag And they do, if you have the batteries in it, the batteries will corrode and they may not be it may not be any good. But thankfully, I did not have it stored with the batteries in it. I had the batteries out of it because I have this little medicine pack that I put together at the very beginning of the pandemic. So the pulse oximeter was in there, the temperature gauge was in there. I had medications. I thought about, what were the typical symptoms that my family has. So I had a supply of medications to manage their symptoms. So I knew if I get it, I usually have, I had some Theraflu, cold and flu stuff, because that's typically what happens to me when I get the flu. And this should be, okay, let me go over it again. Contact your primary physician, pulse oximeter, some way to measure your temperature, meds to manage symptoms. And then you got to have an isolation plan, and think about that beforehand, because you want to keep the rest of the household safe. So we immediately implemented the isolation plan that we'd already thought through. And I'm thankful that I'd really had already thought it through, because it was like, okay, it was very efficient the way that we just handled stuff. He has a bedroom with his own bathroom. So he has the ensuite. So it was fairly easy. The challenging part for his isolation was that his bedroom shared an HVAC vent and air exchange with the office that my husband uses. So we needed to have an air purifier also, in addition to having an air purifier and the air cave in his room. So we had an air purifier, 250 square feet, the little molecule. But then I also used the air cave in his bedroom, particularly near his bed. And then we had to put a air purifier in the bedroom that shared the air exchange with his room. So my husband uses that as an office, and we wanted to make sure that the air in there was being refreshed during the 5 to 10 days that my child was going to be isolated. So it's good to have an isolation plan. We had already decided beforehand, like if I got sick, what would happen? If 2 of us got sick, what would happen? Well, if all 3 of us got sick, then it's, our whole yeah, we had to have a plan for that, because we have a dog. So who's going to walk the dog? So we already had a plan, and sort of just we didn't have to think about it anymore. It was just a matter of pull out the plan and act on it. The part that was challenging for us was this happened the same week that my goddaughter was also here for the National Organization of Minority Architects. So she was going in and out, and she was going into meetings and other venues with other people. So we all made an agreement that in the house, even though we weren't necessarily masks, we were going to wear ionizers with each other at all times, and there was air purifiers in every room in our house, and some booster air purifiers, so to keep us all safe. So the same goddaughter who was around all those people at the National Organization of Minority Architects was also in our home where there was an active case of COVID. Okay. And I'm just, so there's a real win here, because I can tell you that my husband didn't get COVID, I didn't get COVID, and she didn't get COVID either. Only my son got COVID. And I'll tell you why he got COVID as we go through this presentation. Okay. So the ionizers work, the air purifiers work, the skin guard works. We had like I said, we had an active case of COVID in our house, and we never caught COVID. Now, it didn't mean that I went into his room, every day with an ionizer mask on. I did the the change of clothes. I had a specific set of clothes that I wore when I went into his bedroom, and then I sprayed myself down with the Clean Smart when I came out of his room, and then took the clothes off and changed into other clothes. I wore something very specific, like scrubs. I wish I had if I was going to do this again, I wish I had the Skin Guard scrubs because they kill COVID. Not Skin Guard, Living Guard has a set of scrubs that kill COVID. If I had to do this again, I'd have that, to wear. But the Clean Smart or the hypochlorous acid worked just as fine. I just sprayed myself down. I used a lot of the hypochlorous in terms of spraying down the house just about daily, every day, just to make sure all the surfaces and all that. Disinfected his room every day. Anyway, every day. And that was basically some of the things that we did to make sure that the rest of the household stayed safe. And then lastly, and this would be true for adults as well, there needs to be it's important to include a plan for the boredom that's going to happen, that's going to set in. We got to day 2 and my child was already bored. Even though he didn't feel well and was kind of tired, he was still bored. And so we had to think about, we did a lot of FaceTiming. We did a lot of stuff where we watched stuff together, even though we were in different rooms. A plan for the boredom, because that was, that was something else. And so in my head, I'm thinking if I get COVID, I got a couple of books I've got on, like on, that I'm ready to pull out, and some things that I can binge watch, keep me occupied for 4 or 5 days. But yeah, it's important to have a plan for the boredom, because that'll be the things that will make people want to leave isolation and quarantine simply because they're bored and and it's important to have some human interaction and something to keep the mind busy. Okay. So,
Dr. Blessman, before you jump in, Christy had her hand raised.
Oh, okay, absolutely.
So, Dr. Blessman, did you have your son to drink extra fluids during that time?
Yes, he did, because he lost a lot of weight. He lost about 13 pounds, I believe.
Mm-hmm.
That is, yes. He drank, a lot of fruit juices, water, anything, Gatorade, keep his electrolytes up.
Stay away, people that are diabetic, stay away from Gatorade. You can get Pedialyte. Yeah. Stay away from Gatorade if you're a diabetic, but I have sent family members and friends cases of water, cases of orange juice, cases of chicken noodle soup. I have shipped it to them from Sam's. I don't know where Sam's, gets it from locally. I send it home to people that are sick, but you have to drink plenty of fluids. And if you could drink hot fluids like green tea, ginger tea, even making you some chicken noodle soup with onions and garlic in it. Those type things help. And my thing is, I always tell people, try not to lay down too much, because if it sits in your lungs and it's not coming up, you need to be coughing. So you need to be kind of moving around. And I know sometimes that's hard for the elderly, but you almost need to sleep sitting up. And I'm talking to you from experience because I was an asthmatic child. So I don't get COVID. And there is a methodology, y'all probably can look it up. Some of the medical people probably know it, where you cup your hands and you tap lightly on your loved one's back to help them bring up that mucus. But you do want that mucus to sit in your system, so you need to drink plenty of fluids.
Yes, absolutely. You're absolutely correct. And Eddie Joe, I don't know if he's on tonight. I don't think I saw his name tonight.
He's here.
He's here?
I know I was feeling a certain kind of way, but he is in the house.
He is in house, but you know, he yes, he had a wonderful recipe for chicken noodle soup, and I did make it for my son. So thank you, Eddie Joe, for that one. So between that and he likes wonton, no, is it wonton soup that they make, that the Asian, it's like an Asian soup with miso.
Yes, I love that too. Wonton soup.
Yeah.
Oh my God, yes.
hmm With
Dr.
chicken.
Blissman, Miss Shirley had her hand raised.
Yes, Miss Shirley.
So the one thing that I wanted to add is if you can get to Home Depot, you know, they have those tie back jumpsuits, which are totally repellent. And sometimes it even comes with the shoe covers and the face bonnet, I mean the head bonnet. When my sister-in-law got her COVID the first time, I sent about 12 of those home. And so for anybody who was going to go in the room, they put those on top of their clothes with gloves. And then they put them outside the door because they are repellent. But I learned that from when I was working in the operating room in the ICU. And if they would let the family come in, then that's what they were required
to
wear. So if you don't have the Living God jumpsuit, that's a good option until you can figure out how to get them. And then the second thing is I spent 5 days touring with my girlfriend who runs a COVID unit. And one of the things that came out loud and clear was that chicken noodle soup is like the state of the art for helping you to bring that fever down and help to start breaking up that mucus. What Christy is saying is real important.
Real important.
Real important.
Yeah. So yes, I was fortunate. My son did he never really had a temperature. He did have some of the mucus and the phlegm. So that was why we started the chicken noodle soup stuff. And that did work to help break that up. And it was amazing how fast it worked. But, you know, he's also 14. So that's a part of, you know, I assume it, and, you know, very strong and very healthy. So I assume that that's some of the reason why it worked so well with him too. But you're absolutely correct.
Let me add this too, Dr. Blessman. So I have a friend that's a cop, but he's pretty healthy, but this is his second bout with COVID. And he works out all the time. But sitting in the sun, because one thing, if you read a lot of the reviews on COVID, vitamin D is essential. And a lot of us Black people have low vitamin D levels because of the pigment of our skin. And a lot of us are not exposing ourselves to the sun. And I'm not saying sit in the sun all the time, but if you have COVID and you can get to somewhere outside, if you can sit outside away from other people, that also helps you in fighting all of the symptoms. You know, if you're burning up with fever, don't sit out there. But if you're not burning up with fever, just getting some sunlight actually helps you a lot.
Yes, absolutely.
And that's what he told me, because he normally gets over it within like 2 or 3 days. His symptoms are more like allergies or a sinus infection, but it never gets all the way down in the lungs. And he constantly still just walks around and moves a lot. That's why I'm like, sitting down is not the answer.
What was that? Say that again. What's not the answer?
Just sitting and laying down. How people normally think if you're sick, you need to lay down. That is not the answer. And I'm telling you that as a person that grew up with childhood asthma. That is not the answer. You need to move around to get all of that gunk and the mucus and keep it from building up in your system, you need to move around so it'll come up and so that you can cough. You should be coughing. That's healthy because that helps you bring up that garbage out of your system. But remember, garlic and onions, Black people, that we love stuff like that seasoning, those are natural antiseptics. And Eddie Joe will tell you that too. So if you add that to that chicken soup, that chicken noodle soup, and add a little bit of ginger, all of those things are going to help break up some of that.
Yes, absolutely. Yes.
So the one experience that I had with my nephew is that we had to share the bathroom.
And
that could be so that was a lot different than what you were managing. So the protocol that I came up with was I had so we had the sink area was separate from the bathroom. So I had 2 of those little small mini purifiers in the sink area. And then I had 2 of the mini ones in the bathroom. And then before he went to the bathroom, he had to text me or knock on the door and then let me know that he was going in. Then when he came out, he wiped down with Lysol and Clorox, the handles, the doorknobs, the faucet. But then when I went in, I wiped down again. And then he had a big purifier in his room. I had one in my room. We were in the house together for 14 days, bedrooms right beside each other, sharing the same bathrooms. And I never got it.
Amen.
So the purifiers is so important. I mean, it was almost like I had a trail, a light trail, because we had many of them just surrounded us. I wore my tamer all day. He wore his as well. He took me to the airport, and that was the scariest part, because I almost wanted to say, you know what, baby, don't get out of bed. I'll figure out how I'm gonna get there, because I was trying to get back to Chicago. Plus, I was just getting nervous because I had been there so many days, and it seemed like everybody in Houston was getting sick. But he took me to the airport, and what he did is he had that Dr. Roland, that first big viral mask.
Yeah.
He wore that. I double masked. And we both wore the Living Guard gloves. And I told him to, when he get to the airport, just take my bag out, sit it on the sidewalk, get back in the car. Then I started wiping down everything. And then he took off. Of course, when I got here in Chicago, I went straight in, left the airport, went straight in to be tested again. And then I was tested 6 more times, and I never had it. So that was how we managed that bathroom situation, because that's kind of scary when you are sharing the bathroom with someone.
I noticed that you were saying, someone was saying about the garlic and onion. What about cayenne pepper? Is that good to make tea out of, or mix it together with some of your chicken soup or something?
That's good too.
Okay.
One thing about cayenne pepper, it can also be an irritant. So if you're cooking with it, put it in last. Don't cook it while your food is cooking.
Oh.
It doesn't need to cook into, just put it in last, because it can be an irritant on the outside and inside of the body. But it's you don't need that much, a very small amount.
Okay.
If you suffer with hypertension, then you want to look for Siberian cayenne pepper.
Oh.
So it's African bird song.
Oh, okay. Thank you.
Dr. Blessman, I want to ask Christy a question, please.
Sure, go ahead.
Christy, you were saying about not doing the Gatorade. Is that does that also include the Gatorade Zero, no sugar?
You can use the Gatorade Zero No Sugar, but I know because my father is a diabetic that one day he was dehydrated and my cousin gave him a bunch of Gatorades and he almost went into a diabetic coma. So you should never, ever use straight Gatorade. The Gatorade Zero is okay, but the Pedialyte may be a little more balanced. And I just always tell diabetics, be careful with that.
Okay, I'll pass that on. Okay, thank you.
Mm-hmm.
And Dr. Lessman, there is a website for people who are on Medicare who can get 8 free kits for testing each month, no cost.
Oh, every month you can get it?
Every month, yes.
Can you put that link in the
I'll put it in the
chat?
Yes, I'll put it in there now.
Because I know we got, we try to send it out, the link, whenever they've announced that you could get tests, but I didn't know that it had now changed to every month. Because I'm going to tell you, the minute somebody gets COVID in your house, you go through those tests.
You go through the test.
Oh, yeah.
And 8 free tests, that's, I mean, you know, that's good. So let me put it.
You know, and there were 3 people and 4 people in the house, you know, so we were all testing, you know, as, you know, frequently to make sure, you know, I mean, we curtailed some of our activities so that we weren't, you know, I mean, I didn't do as much, but I had to, I still had to go out and do some things. And so I always tested before I went out and was around other people. You know, even the night of the election night party, campaign thank you party, I had to test that day. And that day was a day that my child, was that the day? Yeah, he was still in the middle of his COVID care at that point. So, you know, and that wasn't something that, you know, that I could really miss. You know, but I did, you know, the things that I was involved in, I did let people know that, you know, we have to plan this with with knowing that I might not be able to be physically present because if I test positive for COVID. Okay, so I see that Medicare is now covering the cost of at-home COVID tests for beneficiaries. Okay. Okay. Be nice to have the link where you can actually order it from.
I'm typing it in now.
Great. Fabulous. Fabulous. Okay. So I'm going to talk about, you know, what happened with Sharon and Tommy who lived in Hawaii and just kind of go into some of the particulars. Sharon called me as soon as, you know, as soon as Tommy got the diagnosis. Actually, Tommy went into the hospital first. He was feeling really weak. And it was about 5 days, you know, she couldn't, it was in Honolulu. They wouldn't let her go in to go see Tommy. And about 4 days later was when they told her that he had COVID and that they had given him remdesivir. Now, Tommy's had, you know, he's got kidney issues. He's had chronic diabetes, and some heart issues. He's not on a pacemaker, but he's on something. There's something, they're monitoring his heartbeat. And it's real clear to all of us that Tommy is, he's not in a situation where we think he's going to like get healthy and strong and, you know, get better. It's more like, this is the long goodbye. We don't know when, but we know that, you know, life is winding down for him now, you know. And Sharon was feeling horrible about Tommy getting COVID. She said she went to an event. Now Sharon is, you know, she's very much, you know, a social being in and around Honolulu. She was at an event, a poetry, Sisters Across the Ocean, a poetry event between Hawaiian, African-American women who live in Hawaii and African women. They had done some joint poetry writing together. And she was there to do the welcome. And she said I had forgotten, but I had gotten her ionizer. And she told me, she admitted, she said, I forgot, I didn't have it on that day. And she took her mask off to give the welcome address. And then she came home to Tommy. Now, she was, part of and I'm able to tell this story because she told me, I let her know beforehand that I was going to talk about this. And we're going to actually talk about it on her show this coming Thursday. But she felt horrible about that she brought COVID home to her husband, who's already in fragile medical health, despite the fact that she had everything that she needed in order to keep him and her safe. And so part of the discussion that I had with her was around, in this day and age where nobody's wearing a mask, everybody's acting like, COVID is gone. It's real easy to let our guard down. And truth be told, there were a couple of times that I let my guard down when I was caring for my child. So I'm not perfect either. It's like, and I know that. Okay. But in the moment, in that moment, oh, thank it, so she, but that was one of the things that we did. And I'm glad that, she felt comfortable enough and felt that she would be received with sufficient grace that we could sit down and have the discussion about, okay, when did you let your guard down? And what do we need to do in order to not let that happen again? Because, this is the kind of thing that could potentially, if this had happened 2 years ago, this could have taken Tommy out completely. Before we had remdesivir. So we had that discussion. Now, mind you, I live in Chicago. Sharon lives in Honolulu. So her, their children, Tom, they don't have any kids. Tommy has some adult children, but they all live across the pond too. They don't live in Honolulu with them. And so we started talking about, okay, what is the care team going to look like? So there was somebody, we pulled together a care team. There was somebody in their building that was able to run errands for them, make sure that they had meals, go get things for them. So there were like 5 of us who were on the care team. So our jobs, we had different jobs. We had the person that was like right there in their building. Then we had another person who called every night. I had the morning shift, and we had Dr. Joanne, on call if we needed. She texted Sharon every day, and the neighbor made sure she put eyes on Sharon and Tommy every day. And that's what I meant about, when you get the information, oh, just go home and isolate, and you in your late 70s and early 80s, that's crazy because, in situations like this, COVID can overtake people within 4 to 6 hours. And if there's not anybody regularly checking in and, having some kind of care plan or some kind of way of making sure that they're okay, they can easily, start having some difficulty. And also understand that Tommy is not in any position to take care of Sharon. He's, his thinking is different now, little memory issues and, dementia and all that. So Sharon's the one that's, if she goes down, the whole household goes down, more or less. And it's not like if she's ill, he can fill in and go call the ambulance or go call the neighbor or whatever. So that's why it was important to have somebody on site, and everybody had everybody's number. And there was a daily report that was made. Okay, I talked to her at 10 o'clock. She was doing fine. Her pulse oximeter readings were good. Temperature was this. Tommy's pulse oximeter was whatever. His temperature reading was whatever. They had energy or they didn't have energy. Then there was a person who checked in with them. And we basically told Sharon too, if we don't get you, we're going to be calling somebody to do a wellness check on you. So the neighbor had a key to their apartment. So, so basically we had it covered. So like every 4 hours, there was somebody calling and or texting. Now we realized at some point there was times where she couldn't talk that much or that long. So we didn't prolong it, but there was somebody that was checking and calling. And then their neighbor went in every day to make sure that she laid eyes on them. So it is possible to put together, a care team, even if you're not in the same state, as long as there's at least one person that can go in and see them and lay eyes on that person. Now, what's interesting is that how care can be different from one place versus another. Because I had another friend who lives in Grand Rapids, and when she got COVID, they had a visiting nurse that came out and who called and checked on them every 4 hours and asked for their temperature readings and all that stuff. And I was like, we don't get. She is of a different persuasion. Everybody that I know, all my friends who had COVID, who were of a different skin tone, they got a whole different level of care than my folk. In terms of just people being attentive. As I said, with Sharon, they were told, go home and isolate. Nobody said it, nobody even, because even if Sharon didn't tell them that she had a comorbidity, it wasn't like somebody even asked her, do you have any underlying illnesses? Nobody even asked. They just told her, go home and just isolate. And that to me is poor quality of care, because I would think that for anybody that gets COVID, that should be a basic question that any healthcare provider should be asking. And, but, what can I say? Anyway.
So Dr. Blessman, every time you tell that story, I get like chill bumps, because the thing that needs to be emphasized is how she accessed that care at the point of care, right? Testing positive for COVID, and they told her to go home at 74 years old, and her husband, go home. It's like, go home and die.
Yeah.
Right? And that's basically where we were left. So, it's not getting any better for us. It's just that this information about COVID and what's happening in the country is just, if you're not looking for it, they're not going to tell you about it.
Exactly.
Doctor had a win at the beginning of the program. I have a loss. Another one of my sister's friends, her mother passed. They just eulogized her on Saturday. Marvin Sapp's son never would have made it. And that was the message that I received about this woman's demise. She was in her early 80s. She caught COVID and never recovered, but her symptoms were different. It wasn't the immediate, or should I say, her care was a little different, because she wasn't put on a ventilator when her oxygen level dropped to ventilator necessity to stay alive. They gave her oxygen instead. The COVID went away, but pneumonia settled in, and it didn't take long. It took about 5 days, and she was gone. They said her lungs had turned to jelly. So, you know, until you get those stories, intimate, I know this person's stories, the information is just not, it's just, we are not going to read about this lady in Dallas news. It's because the story was shared with me. So I think what I'm going to do quickly, because we do have B4 and B5. So let me go ahead and share the screen.
And the other thing, you know, that I will also say that Sharon and them also listened to was they did get the Pneumovax 23. So they did have the pneumonia vaccine beforehand.
And I thought about that too, doctor. I was like, well, I wonder if she would have gotten the Pneumovax, would she have gotten the pneumonia? But she's she was 82 years old.
Probably not, Michelle. To piggyback on that, all of y'all who have not had the Pneumovax, some of y'all are getting 23 if you're older, but those of us that are younger, we get like 20 and 21. Go and get your pneumonia vaccine. My allergist pushed that, and I went to see a pulmonologist because, you know, I thought I was exposed to asbestos. And he is emphasizing that too. That will help a lot. So make sure you are getting your pneumonia vaccine.
Right.
I have to, now I can get my pneumonia vaccine now. I have been so vaccinated over these last 6 months. I just recently got that 4th booster, but I got the Shingrix vaccine as well at the same time. And it was my 2nd series of the Shingrix, and I didn't have a bad reaction to it. It was just too much medicine.
Yeah, that was too much.
Running through my system at one time, and it just kind of had me off kilter. And I think I'm still a little bit like, ugh. And as soon as I get this feeling off of me, I'm gonna go and get that Pneumovax.
I actually think the Pneumovax is even more important than the shingles. Because if you get COVID, most patients, if they get it bad, they're gonna go into the pneumonia. So it's almost like a booster. It's gonna help you not to get it, not to get pneumonia. And if you don't get pneumonia, you may really have a great chance of coming off of the oxygen. I mean, I've seen people who've actually come off the ventilators 42 days later, alive, because they had that pneumonia, that Pneumovax.
Yeah, the Pneumovax.
Yeah. So I think it's real important.
I agree with you, Shirley. And my doctor even wanted me to take both of the pneumonia shots. So I took one in 21 and the other one in 22. She felt it was just that important. So I did too. But Miss Michelle, I sent you an article and some data to share with Dr. Blessman and the community. Did you see that?
I did see that. Hold on.
Okay. It doesn't have to be tonight. I just wanted to make sure you got it to share.
Yes, I do.
Okay. Which, by the way, are you talking, Dr. Bless? Dr. Blessman, you talking?
And she's on, Doctor, you're on mute.
Mute.
I do that all the time.
Sorry. No, go ahead, please.
So I just want to do a quick update. I'll just update periodically. I had asked the question when we had the daughter for the person who did the skin guard for us. Yes. About using that on the scarring from the shingles on my face. And it is making a breakthrough. It is clearing it up. and all of the damage to the nerve endings is clearing up. So
Oh,
this
wow.
is like almost 2 months later, and it's doing a great job. So I'm documenting that.
Oh, wow.
Mm.
You might have to write a blog too, Doctor.
Yeah, absolutely.
Shirley, we still waiting on Miss Shirley. We still waiting on your blog, ma'am.
I got your information.
Okay.
I know you got a new job, but you're gonna have to help me out.
Yes, ma'am. I have a situation. I'll tell you about it offline that I'm
Okay.
actually giving like 90% of my energy to. I guess I have a deadline date. I have my right to sue letter.
Mhm.
And so I have to sue or at least file my suit within the next, well, my drop dead date for my personal self is the end of July, but the actual drop dead date is August the 16th. So I'm a little under pressure, but I'm gonna get it done. And then the grandkids are here, but that blog of yours, we have to tell people, because the people who won't come into our Zoom, they read our blogs, they read our Facebook posts, and so they are getting information in more ways than one. So the blog will be just superb. We'll make it fun and engaging and insightful and relevant, and we'll explain, you know, why you protected your guests the way you did. Because I'm excited. That party was so fierce.
It was.
It was. I know we only have a few minutes left, but I see some new names in our Zoom, and I'm not going to call anybody out because they could be returning guests, but using a different name. But I'm excited that they have joined us. Thank you for coming. Keep coming back as long as you see or receive invitation to come into our community and share information. Keep coming back. Mr. Eddie Jones, he wrote a recipe for chicken noodle soup. I shared the screen of his recipe and his little blurb about why he not only make the chicken soup, but why it's important to him. And I think it's a cute little narrative. So if you want a copy of his chicken noodle soup recipe, go ahead and put your email address in the chat and I will get that out to you. There is the screen share for the BA.5 and where the BA4 was and is. And we can see that BA2 is leaving the population. I'm not a scientist.
Yes, you are.
To in my own regard, right? A scientist without the scientific degree. But
you are a public health scientist.
Health scientist, right? Okay. So I know a couple of weeks ago, Dr. Westman was like, "Oh, the rates are dropping and the death is dropping and this."
No, they're back up again.
But I still want us to be vigilant. It's difficult living in a society that does not respect a virus, in that everything we touch, everything we see, everywhere we go, people are living their life seemingly in some freedoms. They're not wearing any masks. They go where they want to go. They do what they want to do. It is not daily, hourly, every minute. We don't see commercials about air purifiers, why we wear the mask, why we wear or use products like Clean Smart and Skin Guard, and all the other great products that we have access to and that we know about. It's only when we come into this room are we able to express how important our biosafety protocols are. And we can also share with each other, you know, the fact that, damn it, I dropped the ball, right? I went here, shouldn't have, but I did. And then we come home and we think, oh God, please let us not have COVID, but we got some home test kits. We have some meds. We have our oximeter, our thermometer. We have our game plan, just in case we test positive. But we know how to protect ourselves, and we know the products that are out there. And the reason why I'm pointing this out is because this virus is changing yet again. And whatever genetic, scientific coding is made in this virus, we don't know when it's going to be done, right? So I just read an article where the CDC is putting monkeypox on alert. We can go back to, you know, the one side is saying it's a gay man situation, but I can go all the way back to 1980 when it was a white male gay disease that turned into a Black woman pandemic, and it only took 30 years. So, you know, viruses, they don't discriminate. They don't care if you gay, straight, transgender, bisexual. It doesn't care. It's going to find a host. Meningitis is now a part of the symptomology. I think Ms. Wright put that in the chat. Part of the symptomology of the BA5. And then here in the state of Alabama, we are suffering from a hepatitis A outbreak. And that just means people are not washing their hands, and they're handling food. I mean, it's just becoming a cesspool on top of a cesspool on top of a cesspool. So please continue to keep yourself protected. We still have the Skin Guard at a discount. Enhance your biosafety plan if you need to. Your caregiver instructions. Who are you caring for? What will happen if you get sick? How do you manage your household and their needs? And if you do get sick and you are struggling with managing your situation, please reach out to either Dr. Blessman, Justin, or myself, so we can at least look for some resources, be a resource, and get you to a place of wellness.
Yes. Yes. Absolutely. That was a wonderful wrap up, Michelle.
Thank you, Dr. Blessman. It's been a rough week for the American people, whether you are childbearing, whether you are pro-choice or pro-life, whether you are a climate denier or, you know, you understand the climate change, whether you are pro-gun or, you know, gun control advocate, we are definitely at some kind of crossroads in our country. And, you know, I think I stopped pledge allegiance to the flag when I was in the 8th or 9th grade, because, you know, I'm a critical thinker. I started thinking about some stuff. But that was my choice because of how I was thinking. But I'm still an American. That's all I know. It's where I was born. I pay my taxes. I vote. I'm not childbearing, but dang it, it's a right. And the minute that our rights are in jeopardy, that's some shaky ground we standing on. And so, you know, my mind, my thoughts, my feelings are everywhere. So, you know, send me some good positive energy because I need to file this locked. It's gonna happen. But I want to take us out. Our song. I say it's my song. Our song.
Before we go out, please check the chat. Eddie Joe left a wonderful alternative to Gatorade or Pedialyte in order to get the trace minerals that you need in order to stay hydrated. And because of the heat, we should all be staying hydrated anyway. So we want to make sure that people keep our electrolyte levels up. And he's also got a great recipe for a super vitamin C booster. And we will take us on out, Michelle. And thank you everyone for being here tonight. You know, our goal, as always, is to thrive and not just survive this pandemic. I want all of you to live robust lives. And even amidst all of the losses, do remember the wins and celebrate the wins, acknowledge the wins, affirm the wins. Keep your eyes on the wins. It doesn't mean that we walk around with rose-colored glasses. That's not true. We do acknowledge the ones we don't win, or the losses that we do face, but it's also important to acknowledge the wins. And, you know, because those are the times and the places where we know that what we're doing is succeeding. You know, and even with, you know, like with my son, I mentioned my son got COVID. You know what? It was probably the best thing that could have happened because now he's taken life a whole lot more serious because he realizes that he could have brought this home to his dad. Everything that we had been talking about now has much more deeper meaning for him now that he's gotten COVID. So I consider that a win too. You know, he's a person in process, just like all the rest of us. You know, he's in, you know, God is the you know, the sculptor and the painter. He's just the canvas and the clay. And so, but yeah. So even when you're frustrated with your people, your children, or what have you, because they don't seem to be getting it, at some point they do get it. And he did not enjoy, you know, 5 days of, you know, being stuck in his room. So this really taught him a lesson about, yeah, I understand that you went to a concert and you had a big fun and, you know, rap concert, and you and your friend was there and you wanted to get into the mosh pit and you decided to he let his guard down because he took his ionizer off and put it in his pocket. And although we had talked about it beforehand and said that was not a good idea to do that, and he assured me that he wouldn't do that, he did it anyway. So now he paid the price for it. He paid the price for it. So big lesson. Life has, you know, life will, you know, give you lessons. I just hope that he learned it now. He touched the hot stove and learned it and won't do that again and be smarter the next time. So you ready, Michelle? Michelle?
The music is coming on.
Okay.
Thank you for sharing.
Good night, everyone.
I appreciate y'all.
Good night. Thanks, everyone.
Good night, everyone. Thank you.
Bye.
Much.